Hello, my name is Rebecca Sneed. I'm a nursing student with Tennessee Tech. How are you today?
I'm doing good, thank you.
Great. Can you tell me what your name and date of birth is?
Holly Hyde, March 14th, 1984.
Okay, and would it be okay if I do a quick assessment for a video for nursing school?
Yes, of course it would.
All right, before I get started, I'm going to go ahead and wash my hands. And I'm going to ask you just a few simple questions. You already told me your name. Can you tell me where we're at today?
Full Circle Medical Center.
All right, and what is the date?
The date is June 25th, and it is Thursday of 2026.
All right, and what are we doing here today?
You're assessing me for a nursing video.
Perfect. So my patient is alert and oriented, ×4, and just a pain assessment today. Are you having any pain?
So in my neck.
In your neck, okay. And what would you rate your pain at? 1 being the least amount of pain and 10 being the greatest.
About a 4.
About a 4. And when that pain began, is it something that you've had like for a long time chronically, or something that just started
About 3 or 4 days.
3 days ago? Okay. And can you describe that pain for me?
It's just like
Just a little achy. And is there anything that makes it better?
sometimes I put heat on it and massage it.
Okay. And anything that makes it worse?
When I move it too fast.
All right. And have you had any like pain medication or anything?
No, ma'am.
All right. So we're going to move on to a respiratory assessment. So I'm going to begin just looking at my patient. So she's sitting in an upright position. I don't notice any signs of distress. Her skin color is good. She's a nice tan color. Her lips are good and pink. I don't notice any like use of accessory muscle. So it looks like her effort is minimal in breathing. Her depth is normal, regular rhythm. Are you having any cough, or have you had any cough in the past couple of days?
No, ma'am.
No cough? All right. So I'm going to assess your breath sounds. Listen 6 places in the front. And for this, I need my stethoscope to touch your skin. Is that okay?
It's perfect.
All right. So, in and out. All right, big deep breath for me. In and out. Good. And again. Good. And again. All right. And do you mind if I get under your breast tissue for this? Okay. In and out. And again. In and out. I'm going to get 2 also on the side here. Okay. And again. Okay, perfect. I'm going to turn this around so the opening is in the back. Big deep breath. Good. Good. Okay, very good. Good. Okay, good. And we're going to turn this gown back around so the opening is in the front. And if it's okay, I'm going to have you go ahead and lay back for me. And I'm going to be checking for jugular vein distension. And I do not notice any on this side. I'm going to palpate the artery. And it's a +2. And I'm going to auscultate with the bell. Okay. And I'm going to do the same thing on the other side. Palpate this carotid artery. Going to auscultate. Okay. I don't notice any jugular vein distension or heaves. So next I am going to be assessing the heart sounds in the 5 different locations. Heart rate is 72 and regular. And the respiratory rate is 16. All right, so I'm going to be assessing your heart sounds with the diaphragm in the 5 noted locations of the heart valves. Okay, and then also right here. Okay, and then with the bell. Then I will be assessing skin next, so I'll be checking upper and lower extremities. So on her upper extremities, her skin is normal in color. It's tan, it's dry, I don't know any moisture, less than 2 seconds on turgor on both sides. I don't notice any edema in her upper extremities. Bilateral radial pulses I'm going to palpate, and they are +2. My patient has fake fingernails on, except for on the right finger there's one that's missing. So I will assess capillary refill beside the nails, and then in the one that's missing, and it's less than 2 seconds. And the nail condition is normal. I don't notice any clubbing. It's intact, and her hair distribution is normal on the upper extremity. So I'll move down to the lower extremities, and I'll note that my patient's hair distribution is, her skin is shaven, so I don't notice any hair. I'll check for edema, and no noted edema. Her skin, I don't notice any cyanosis. It's tan, it's warm, dry, I don't notice any moisture, no lesions. I will palpate her pedal pulses on both sides bilaterally, and they are +2. And then also her toenails have fingernail polish, so I'm going to check for capillary refill beside of the toenail. It's less than 2. Her skin, or her toenail condition is normal. I don't notice any clubbing, and it is intact. And that will conclude my assessment number 2 video.